So if you're a single guy, you have no kids, you're over 50, and somebody's told you that you have prostate cancer. Today, we're talking with Christine because Christine is somebody that could change your life. How did he get here?
Well, he probably got to this point just basically out of a simple visit to his primary care physician.
Okay.
Does an annual exam.
Okay.
You and I both know we've had them. You go in and you do your typical, check your lungs, do some basic labs, and probably the physician took a look at those labs and noticed that maybe his testosterone level was low. His PSA level, which is short for prostate-specific antigen.
Correct.
And the PSA level was elevated. So that's immediately a red flag.
So it's just a normal day.
Yep.
Went to a normal appointment.
Yep.
But he got the word cancer.
Right.
Got the word prostate. Got the word
metastasis.
Here in these letters, PSA now.
Yes.
Okay. So tell me about the difference between PSA and PSMA.
So PSA is the lab test. That's the prostate-specific antigen lab panel.
Okay.
PSMA is your prostate-specific membrane antigen, and that is done with a PET CT scan.
Okay.
So chances are now, not only did he get the results now of his blood test and now has been told to probably see his urologist, and goes to see the urologist, and now some more tests have been ordered. He probably was ordered a PSMA PET CT scan, and basically what they're looking at is it metastatic?
Okay.
Do we see the spots? Do we see where the metastases are? Or that they've had a bone scan?
Okay.
But the urologist has probably said to him, I suggest that you let me cut your prostate out.
Wow. So that's big red flag, right? On our side? Okay. Let's before we talk about what no one wants to talk about, let's give this a little context, okay?
Okay.
He's probably in a waiting kind of a loop now. Mm-hmm. Now everything's about waiting and seeing and learning, and he doesn't have a lot of information. He's on his own. He doesn't have any kids. Doesn't have a wife. He's on his own. Mm-hmm. His primary care doctor recommended a urologist or an invasive treatment. We know there's a better way, but what is it that nobody's talking about? What is it that no one wants to talk about? Because, just go to your urologist, have it cut out, problem's over, right?
Right. So he's probably now been, chances are before he ever left that visit, he's been told that I highly recommend that you get a prostatectomy. And let's put it this way. My very first call today started with a 57-year-old male who's now been diagnosed with prostate cancer.
Okay.
Went to see a urologist, and here's what he said to him. He said, let's do a prostatectomy. I think I can get all of it.
I'm sorry, did you say think?
Right.
I think I can get all the cancer. I want to cut something out of your body because I think it might work?
Right.
Okay, that wouldn't sit well with me at all.
Which is why he called me this morning, because he had three other opinions.
Okay.
He literally drove and flew to 3 different states, and finally the third one said, you do not need to have a prostatectomy.
So just by watching this video, you can understand that somebody else in this guy's position already drove to 3 different states, already got 3 different opinions, already did all that hard labor to find out that I think isn't solid enough.
Correct.
He needed more opinion. Okay, so is he receiving hormone injections yet, or is this just the urologist?
Well, chances are the urologist might have started him on, let's say, a Lupron injection.
Okay.
And that would be okay for the simple fact we want to keep it at bay at the moment.
Okay.
While the patient's thinking, do I want a prostatectomy? They've already got me scheduled.
What happens if you get a prostatectomy? I mean, I'm a guy. I want to know.
Well, it doesn't come without other side effects.
Okay.
And the patients that I have had prostatectomies are now experiencing incontinence.
Okay.
I've had patients that have come to me crying because they are now impotent.
Okay.
And they are constantly in the emergency room because they keep catching urinary tract infections. And they're in a lot of pain.
And this is something that is happening to a lot of people, right? A lot of guys, a lot of single guys.
Do you know the majority of the patients that I see have already had their prostatectomy? And when they find out that they didn't really need that surgery,
It has to be.
they just can't believe it. And they want to know, why was I encouraged to have this surgery? Why didn't I know that I really do have the right to go out and find other options?
Well, there's got to be hope. There's got to be a solution. And I believe that's what we're here to talk about.
Yes.
Let's focus on this for a second, just so that they can be a little at ease. You know, they're on their own. They don't have a wife. They don't have kids. It's just a guy being a guy, trying to get along, trying to live a full life. What, just for, to be devil's advocate, what would make you the expert?
Well, what makes us the expert is that we live it, we breathe it, we sleep. I mean, we wake up to it. We have an entire team that is committed, literally in the lab, doing research, working on these trials, trying to find the right therapies that is eventually going to cure this cancer. But that's exactly what we have. We're working with the best clinicians.
So this is your life. This is all you do.
This is what we're committed to doing.
According to my notes, you've been doing this for 3 years straight.
3 years straight,
And I know how late you take phone calls, too.
Yes, I take them at all hours, actually, especially because cancer never sleeps.
Well, and evidently you don't either at some points. I'm sure they're going to really be happy to have you on their team.
Yes.
It's a waiting game. It's a clock ticking game. It's an unsure where to turn next type of game. And I really want all these single guys that are facing this alone to know that they don't have to be alone. The doctor's going to take the journey with them. That's something you told me about. What is that? I've never heard of anything like this. I mean, you're talking about red tape, corporate policies, hidden agendas, and now you're telling me that a doctor is going to take the journey with the patient?
Yes.
Explain that to me.
Well, our chief medical officer is not only committed to being in the research lab and finding every right component that's going to help cure cancer, but he takes the journey with the patient. Literally, not only do I take the initial call, but then he also spends time. He never puts a timeline on that first in-person visit with him.
Wow.
He sits down with them. He welcomes them. He prays with them even. And he sits down and he says, how did we get here? So let's talk about what we can do to get you on the right treatment plan.
People are waiting years for treatment.
They are.
People are waiting years after all kinds of visits, and time is the most important thing to these guys, I'm imagining.
Right. It's like they mentally, that they know the clock is ticking.
Okay.
And they only know what they've been advised to do.
Okay.
Right?
And there's, like you said, there's a set kind of order for this right now, but it's not the only way, is it?
Correct. Right. So the FDA absolutely has approved a particular medication which falls under theranostics. It's a little bit of therapeutics and a little bit of diagnostic combined.
I saw the commercial on college football.
Pluvicto.
Pluvicto. Okay.
Yes. Yes. And it is the PSMA lutetium 177.
Okay.
There are facilities in the United States that actually can administer it. However, the FDA approval and the insurance will only authorize it for the patient if and only if they've met all these other criteria.
Like?
You have to have undergone so many rounds of chemotherapy treatment.
Wow.
radiation. They had to have already been on hormone injections. Basically, all the things that pretty much has killed all the good cells inside their body. Because a patient doesn't know what they don't know. All they've heard is the word cancer. So they're looking to the physician as being the expert. So
Correct.
When a physician says this is the path you have to take, they pretty much are going to follow it because they don't hear anything else except for the word cancer. They don't think that there could potentially be truly another treatment option, a more targeted treatment option,
That's
a more
what I've heard about.
precise treatment option.
Yes, I've heard it's not burning down the whole forest.
Correct.
Now you could just find the diseased trees, get rid of them,
Right.
shrink them, whatever it is that they do, and move on. Well, if they can avoid getting their prostate out, they can avoid having cancer altogether. So this sounds like a really good option. What is the best way for them to take the first step?
The first step is to call me.
Okay, and how much would this usually cost them? How much would they have to pay for this interaction with you if you were at one of the big corporate places or if you're at a big hospital? How much does it usually cost?
For that type of a consultation is minimum $2,000.
Okay, and I know you're really trying to save lives here. What are you offering them? How much are you going to charge them for the consultation?
We will see them free of charge. We want to sit down with them. We want to consult with them. We want to hear a little bit about their history, how they got here, and then our plan is to custom build a treatment plan that's good for them.
Okay, and is this something that they're going to have to wait a long time for?
Well, for those that try to go through insurance, and that will be based on of their age and all the other
All the other
criteria we
factors,
talked
yes,
about, right?
the insurance algorithm,
Right,
yeah.
but you'd be surprised how many patients that say, are you telling me that you are affiliated and partnered with other facilities that are in other countries that will do this kind of treatment and I don't have to wait? And we say absolutely. We have the best physicians that have been treating these patients for over 2 to 3 decades, and we absolutely have those relationships and we can get them to those specialists.
So you can already have your prostate out. You're dealing with cancer. Now you have to wait an additional X amount of months, years
To see if
just
you
to be
even,
seen.
yeah.
Or if they call you, they can deal with the same level of educated doctors.
Yes.
The same, almost, some of them are the same doctors from these places, right?
Yes. Mm-hmm.
So it's FDA approved, and you don't have to deal with any of the red tape or corporate policy. So if it works out, I could call you today, and maybe within a week, I'm already on the road to recovery.
Yes.
Wow. Okay. Well, please make the choice that gives you time and hope back. Please call Christine today and see what she can do to help you.